Good morning. Today we shall discuss a case scenario. A 15-year-old female presented to the emergency department with the history of recurrent epistaxis, hematuria, hematochezia, and there was a history of profuse bleeding from the umbilical stump at birth. Previous investigations revealed normal prothrombin time, activated partial thromboplastin time, thrombin time, and fibrinogen levels. A platelet count as well as a platelet function test were normal, but urea clot lysis test was positive. Which of the clotting factor is deficient? Okay, now let me tell you the answer. The answer is factor 13. Fine. So we shall discuss a few things about factor 13 and then we will come to this MCQ. So if you look at factor 13, as we all know, the other name for factor 13 is fibrin stabilizing factor, right? So it is the main function is the stabilization and protection of the newly formed fibrin, right? So it is a very rare autosomal recessive disorder. It is a very rare autosomal recessive disorder, and if you look at the structure of this, it is a tetrameric structure and it has two subunits, A subunit and B subunit. So the deficiency of the A subunit is more common. Okay, so if you look at the criteria, the hallmark criteria for a diagnosis of a factor 13 deficiency, is ultimately going to be your investigations. Apart from that, 80 to 99% of the cases with factor 13 deficiency will have umbilical stump bleeding. Fine. And if you look at the laboratory investigations, you have your bleeding time, prothrombin time, activated partial thromboplastin time, thrombin time, platelet count. All these will be absolutely normal, right? And okay, how to detect it? We have your factor 13 your activity to or antigen assay or molecular analysis. So using these methods you can actually detect the levels of factor 13. So if you look at the normal prothrombin time, it is around 11 to 16 seconds, and activated partial thromboplastin time is around 30 to 40 seconds, and thrombin time is around 15 to 19 seconds. So if all these factors, all these values are normal with umbilical stump bleeding, that is a hallmark diagnosis of factor 13 deficiency. So coming back to the MCQ, here you see some non-specific findings like recurrent epistaxis and hematuria and hematochezia, which is nothing but your blood in your stools. All these are non-specific. You can see that in any clotting disorder. And umbilical stump bleeding can also be seen in factor 10 deficiency. But what rules out the factor 10 deficiency is you have your normal prothrombin time and activated plasma thromboplastin time, right? So if you look at factor 10, which is your start powder factor, right? Here it is a vitamin K dependent serine protease, and it is the first enzyme in common pathway. And what you see in factor 10 is very important. It is your increased activated partial thromboplastin time and prothrombin time. So both these will be increased, but here it is absolutely normal, so factor 10 is ruled out. And if you look at factor 11, which is your plasma thromboplastin antecedent, so factor 11 is also a vitamin K dependent serine protease. And if you look at factor 11, you have an increased partial thromboplastin time, which you also see in factor 12, which is your Eggman factor. So factor 11 and factor 12, you see an increased activated partial thromboplastin time. In factor 10, you see increased both your prothrombin time as well as your activated partial thromboplastin time. So this is a very important laboratory investigations which you should keep in mind. So as far as factor 13 is concerned, you have your normal prothrombin time, normal activated plasma thromboplastin time, normal thrombin time, normal platelet levels. All these will be absolutely normal, with 80 to 99% of the cases presenting as umbilical stump bleeding at birth, right? So that's all for today. So thank you for watching this video. Hope it was helpful, and please share with your friends.